Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Imagine for a moment the profound journey of a woman who has triumphed over breast cancer. Her body has endured the rigors of treatment, emerging resilient and strong. Yet, beneath this physical recovery lies a complex emotional landscape. Survivors often grapple with lingering fears of recurrence, anxiety about the future, and the challenge of redefining their identities post treatment. The psychological aftermath can be as daunting as the physical battle itself, influencing overall well being and quality of life. Addressing these emotional facets is paramount, as tailored psychological interventions have been shown to alleviate distress and foster sense of empowerment among survivors. This discussion aims to provide valuable insights, strategies to support those who have courageously navigated the journey of breast cancer survival. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and today we are focusing on the psychological management of breast cancer survivors. To delve into this critical aspect of post cancer care, we are joined by the distinguished health expert, Dr. Manisha Gaur. Dr. Manisha Gaur is the Chief Clinical Psychologist and Counselor at the Gaur Mental Health Clinic, an advanced de addiction and heart to heart counseling center at Civil Lines, Ajmer. With over 2 decades of experience, she is committed to delivering compassionate care and evidence based therapies to her parents. Specializing in a broad spectrum of psychological and psychiatric issues, Dr. Gaur places particular emphasis on women and adolescents dealing with mental health. She utilizes specialized therapeutic interventions to nurture healthier relationships between parent, child, couple relationships, thereby fostering a brighter future for families. Beyond her clinical practice, Ma'am is actively engaged in community outreach and education. Dr. Gaur's steadfast dedication to mental health advocacy and her empathetic approach have earned her recognition as a respected figure in psychology. Ma'am has received numerous accolades, including the Ideal Woman Achievement Award, Women of the Future Award, and the Vivekanand Gaurav Samman in 2021, and others. Ma'am has written and directed and produced a short film on dyslexia titled B for Dole, which was inaugurated by the Governor of Rajasthan, Srikal Raj Mishra. Dr. Gaur is a dedicated researcher and mentor, partnering with esteemed institutions to guide future psychologists and conduct significant studies. She also contributes to literature through research publications, articles in various journals and magazines, and is also a speaker on national radio. Additionally, Ma'am frequently serves as a panelist in discussions and programs on Doordarshan and other television channels. Dr. Manisha Gaur, TIP Media welcomes you, ma'am.
Hello, thank you.
Thank you for joining us today, ma'am. Ma'am, we recognize that breast cancer survivors, they often face significant psychological challenges, and despite the prevalence of these issues, many survivors, they may hesitate to seek mental health support, let's say due to stigma or lack of awareness about available resources. So, to bridge this gap, I'd like to begin our discussion with a fundamental question that what are the common psychological challenges faced by breast cancer survivors and how do they vary across different stages of their recovery?
So basically, in breast cancer, cancer itself is a big, big word. Anybody
Yes,
would get scared hearing about cancer in the body.
yes, yes,
Yeah. So, and breast cancer for a woman,
yes,
breast is considered to be a beauty sign
right,
for every woman. And
Right.
of course, it's an integral body part,
Right.
important body part, when it comes to lactation, when it comes to some intimate needs,
Right.
of course, the beauty for everything. So,
Right.
when a female is diagnosed with breast cancer, it is a sudden shock. So, when
Right.
we talk about the stages, the
Right.
initial stage, the first stage in itself is the one when the woman gets to know that she has breast cancer, the stage of diagnosis. So, that is the
Right.
stage of shock. She
Right.
gets into a sudden shock that, oh, I have breast cancer. How can I get that? Why only me?
Yeah.
Why I? These kind of questions that emerge. So that is the
Right.
stage that what will happen now? Will I survive? How will it go? Breast cancer, cancer, will I die? What will happen of my family? Or if she's single, I have not even lived the life. What will happen
Right.
of my body? So these are the initial things. So
Right.
that is the first stage. Second stage, when she gets into the part where she gets the treatment done.
Right.
So that can be the post surgery, the post treatment, right?
Right.
So if she goes through the surgery, if she go, if the lymph nodes are being removed, so that gives the scars on the body,
Right.
or maybe the breast has been removed. So looking at self
Right.
in a new, in a different way. So there are
Right.
another questions which emerge. The
Right.
post-treatment stage, which is the second stage, that gets in so many questions.
Right.
Uh, Sleep disturbances that
Right.
starts because acceptance is not there for the body.
Right.
Right? Then getting into involving in the society. And how do I go with this kind of a body in a society? People are going
Right.
to laugh at me, right?
Right.
Then the image, the self body image, negative self body image, no?
Right.
Body shaming for the self.
Right.
People would do or not do is a secondary thing. But the person starts doing it by herself if she
Right.
doesn't have that knowledge about it. So
Right.
that image that starts happening. Then the sexual feels that whether I will be, whether will I have the libido now? Will I be able to satisfy my partner now? Will I be able to have the same feel now or not?
Right.
So those questions arise for the sexual needs as well.
Right.
So these are the things which happens post treatment.
Right.
Then comes the third is the later on, once these stages are being done, the third one is that what if it happens again?
Yes.
The long term thing. That comes the third one, that what if I get it again, even if I get cured, with whether I will be able to survive or not.
Right.
ठीक होने के बाद फिर दोबारा हो गया तो फिर क्या होगा? So
जी.
these are the certain things which trouble her. And then
जी.
she develops with the mood changes, irritability,
Right.
depression, anxiety, mood swings, uh, not so comfortable with the partner.
Right.
So secluding herself in a particular area, maybe her home, or avoiding the places, the social places.
Right. So particularly self-isolation and, being a
Yes,
little,
yes, yes.
sometimes they might just, wrap themselves in their own shell that, we are not
Yeah,
comfortable
yeah, yeah.
in a
So they
social
basically
setting.
get into a cocoon
Yes, they do.
and
Right?
they find their
Okay.
own comfort zone.
Right.
They
Right.
try
And
to, but
hmm,
from inside they are not.
well, and I
Yeah.
think that very fight with the cancer and, coming back to a normal life
Hmm.
in itself is a huge challenge. Right. Okay. So then I think these days we are hearing a very important phenomena, and that is
Hmm.
survivor guilt. So, ma'am,
Hmm.
what is the survivor guilt? And, how does addressing the survivor guilt help breast cancer survivors navigate their emotional and psychological recovery journey?
Yeah. So what happens, many a times these breast cancer patients, just to come out of these problems and all that, they go for the treatment. They meet many other breast cancer patients also, other females also. They get into groups.
Right.
They meet each other. Some of them, they get cured early. So they have the kind of, because they share similar kind of problems. So they have similar feelings, thought patterns, and they develop empathy for each other. When they
Right.
have empathy for each other, and one of them gets cured and the other is still struggling,
Right.
and the other is still going through it, sometimes the one who gets cured gets into the survival. Oh, I'm
Right.
okay, but she's not okay. What if something happens to her? What if I also get it again? What all these things, if that occurs again? So if
Right.
all this is happening, and if she's not made aware of the fact, of she's not made, if we do not talk about the survival guilt, if we do not address the guilt areas of that patient, of that breast cancer female, then she might get into depression. She might get into anxiety,
Okay.
which again takes a toll over her mental health, which
Okay.
affects all the daily activities,
Right.
all the daily activities. So that is very disturbing. The
Indeed.
concern about the fellow people.
Right. And I mean, you just mentioned that they go through a lot of issues such as mood swings and, self-image related issues. But the important part is addressing these issues, right, ma'am? So, what interventions are available to help breast cancer survivors rebuild their
Hmm.
self-esteem and
Hmm.
body image,
Hmm.
especially for the ones who've undergone, let's say, mastectomy or, breast reconstructive surgeries?
Hmm. So, those people, especially those who go for mastectomy or breast reconstruction, so we have so many psychological interventions for all of them.
Okay.
Uh, Basically, all the family members, social people, हमारे यहाँ in India, we get free advices everywhere.
Yes.
Everybody would do, oh, you should thank God that you have survived at least.
Yes.
You should see, look at her. You should
Hmm.
thank God that you have survived. But we don't have to make them feel this, that you should thank God that you have survived, at least tell this,
Yes.
because it is so natural to go through all those feelings.
Right.
What the breast cancer patient is going through, even after the recovery, that's a
Right.
natural feeling because she has actually lost one of her organs.
Right. Yes.
So it is a natural feeling. So rather than asking her to compensate, accept the compensation about it, that you have a life. Uh, if you have lost this, doesn't matter, you have your life. But everything matters, everything has its own importance. So rather
Right.
than saying this, I think the family has to support. They should stop
Right.
saying these things that you should thank God. Usko dekho, she's lost her life, but you're at least living.
Right.
No, her feelings should be acknowledged.
Right.
Then she has to take, if the family members are not able to help her out, it is better to take professional help from the
Okay.
psychologist.
Okay.
And there's no harm seeing a psychiatrist as well. We have a
Okay.
big taboo. पागल थोड़ी है
Right.
जो
जी.
साइकाट्रिस्ट के पास जाए या साइकोलॉजिस्ट के पास जाए, बट ऐसा कुछ
जी.
भी नहीं है,
Mhm.
right? So we have cognitive behavior therapies where the
Okay.
restructuring of the thoughts are being done, where they
Okay.
are being taught to think positively, and
जी.
the negative thoughts are being changed by the positive thoughts. There are so many activities like mindfulness, where the people are taught, those females are taught so that they can focus on the present and they can enjoy
Right.
what they are doing, right? There are so
Right.
many relaxation therapies which are taught to them, Jacob San and so many others. They
Right.
are taught to them so that they can relax their body, they can manage their emotions, they can control those negative feelings and the negative hormones which are, bubbling inside, so that
Right.
they give them a lot of stress. So
Right.
that can all be managed with so many of the therapies. Then we have so many group therapies. Group
Okay.
therapies also help them out to go through with all those things. People who have come out of all the problem and they have a group and they share their problems and how they're recovering, all these things. So we have so many therapies. And when these people go through these therapies, they feel much, much better.
Okay.
Specifically, we have, when they come to us, we tell them particular things that getting, especially the breast cancer patients, for them it is very important if they go back and be with the garden, the greens,
Right.
right? Uh, they go back with their hobbies.
Okay.
So that can be maybe dance, maybe
Right.
going for a walk every day, maybe with the music.
Right.
They can be they can focus more on the other parts of the body,
Right.
just not focusing on the breast, but other parts of
Right.
the body. Getting ready, wearing such some good clothes, or if they are fond of makeup, they can get on with that. No, all those things. Getting into taking care of the household, अपना घर decorate करना है,
Mm-hmm.
and getting back to work is again very
Okay.
important. Not that
Right.
कि घर में रहना है.
जी.
Getting back to work.
ओके, राइट। और अभी जैसे हमने बोला, आपने आपने भी बताया कि इंडिया में हर कोई बहुत फ्री का एडवाइस दे,
हाँ,
एंड कुछ एडवाइसेस हमें ना जनरेशन से भी दी जा रही हैं,
हाँ.
दैट इज बी, जो हमारे केस में हम कह सकते हैं इनहेरिटेड एडवाइसेस होती हैं, दैट यू बाउंड टू फॉलो दैट, राइट। सो मैम, डू दीज कल्चरल एंड सोसाइटल फैक्टर्स influence the psychological management and coping mechanisms of breast cancer survivors?
Some of them, yes. Some of those people, जैसे generation से जो advices दी जाती हैं,
जी,
some of them, yes. If they talk about, if they are like we have. I believe in this, which yoga was already there in our generations.
yes,
All right. So, like when our ancestors or when our people, elderlies, they tell us that you must start to meditate, or you must start
जी,
to go for some of the yoga exercises, or you must
जी,
work on some of the routines or some of the food habits,
जी,
which certainly helps those people. If they
जी,
ask, okay, if you are suffering from this, do not get into too much of alcohol.
जी,
So that is required. So if you're
right,
suffering from if a breast cancer patient goes with a lot of alcohol, a lot of tea, a lot of caffeine, a lot of junk, it is certainly going to affect them.
right,
So too many colors in the food or
right,
alcohol, all these things, they must be avoided, which
right,
our ancestors or people, they tell us.
right,
Like the pregnant women, they are told, kacha papita nahi khana hai.
हाँ जी, नहीं खाना है,
Yes.
राइट। ओके, अभी जैसे आपने बोला कि माइंडफुलनेस इज अनदर फैक्टर जिसको प्रैक्टिस करने से ब्रेस्ट कैंसर सर्वाइवर्स के केस में हम थोड़ा सा एक इम्प्रूवमेंट ला सकते हैं, राइट मैम?
Hmm.
सो
Hmm.
what role does mindfulness and stress reduction would play in improving the mental well-being for the ones who are surviving or undergoing the treatment, or they are still in their recovery phase from
Huh.
breast cancer?
Right, right. So, what mindfulness does is, so I just told that mindfulness is to get the person in the present, to focus.
Right,
So,
right,
basically, what we teach in mindfulness when a person comes to us with a lot of anxiety, so like the person with the breast cancer is coming with a lot of anxiety, क्या होगा,
right,
कैसे हो, रिकवरी
जी,
होगी कि नहीं होगी,
नहीं होगी,
ये सारी चीज बहुत बहुत सारे सवालों के साथ. So, it's a phase where the person gets calm, the muscles gets relaxed. All the five sense organs are being trained to stay at one point
okay,
so that the person is able to enjoy the work he or she is doing. Say, for
okay,
example, even if you're eating food
right,
or eating a chocolate,
okay,
लेकिन आपका दिमाग में बहुत सारी बातें चल रही है, आप कब वो चॉकलेट खा जाओगे, you will not even know,
right, right,
right? You're eating also and you're not even knowing about it. So
right,
what mindfulness would do, that you will relish, you will have the taste of that chocolate, you will have the fragrance of the chocolate, you will feel that moment and you'll enjoy it. And how does it help? When we're using all our sense organs mindfully,
जी,
when we are doing any work mindfully, we if even if we are eating, we take 80% of the nutrition. Our
जी,
blood takes, our body takes 80% of the nutrition of the food. But if
Right.
it is not done mindfully, hardly 20% of the nutrition is taken by the body of the food.
Right.
That
Right.
is the difference. So if you're doing some work, even if you're studying or doing something, and the mind is running somewhere else, we are not
Mm-hmm.
able to memorize the things and we are not able to retain and then register and recall.
Ji.
So that is what happens with the breast cancer people also. Because they are
Right.
always going with the thoughts, they are not able to focus,
Mm-hmm.
heal, to get healthy, and they're not able to focus on the recovery. Ki what
Right.
next can I do?
Right. Right.
Yeah.
एंड हमने अभी सेशन के स्टार्ट में एक बात और डिस्कस की एंड दैट वाज अबाउट द सपोर्ट फ्रॉम द फैमिली व्हिच इज ऑफ
Huh,
utmost importance,
huh,
right?
right,
So ma'am,
right.
what strategies would you recommend the caregivers and family members to adopt to support their loved ones, who are who need this psychological recovery?
Right. So, first thing which I discussed earlier also, उनको
Mm-hmm.
बार बार ये अपनी तरफ से जो वो सांत्वना देते हैं ना कि you should thank God, you should thank God, you should thank God. It's good to be grateful. It's good to have that feeling of gratitude, but do not make them realize that उनके ऊपर कुछ दया की गई है.
जी.
वो दया के पात्र नहीं है. So they are rather, I would say, they are the soldiers, the conquerors.
Yes. Yes.
Yeah, they've conquered something.
Yes.
So they are not daya ke patra. They're the heroes,
Yes. Yes.
right? So that
Right.
feeling should not be there.
Right.
That family members talking about the same thing the entire day should
Yes.
not be there. Everybody
Yes.
is coming. घर में बहुत सारे लोग होते हैं, friends होते हैं. Everybody is coming and talking about the same issue.
Yes.
Takes a toll over the mental health,
Yes.
right? And that makes the person isolate herself in a room, that I don't
Yes.
want to talk to anybody. Whosoever will come, we'll talk about this,
There's something.
right? So not talking about it, discussing about it much. Then there are so many other things what they can do. Planning the day activities with your loved one, the
Yes.
person who's suffering, maybe, with your friend, if she's your friend, if she's your partner, if she's your mother, if she's your, so the planning the day, planning the activities. If she's your partner, it's very important to share all the feelings with her. So it's very
Right.
important for the partner, a male partner, to listen and hear all the things, what she's going through, what she's feeling, so that she
Right.
doesn't have, she's not scared of her intimate relationships with her.
Right.
That is something जो किसी भी relationship के अंदर बहुत important होता है. और वो चीज अगर sexual life अगर disturb हो जाती है, तो it takes again a toll. So a partner has to understand and listen to all the things calmly, a male partner. So that is very important कि वो शांति से सुने. अगर लगता है कि husband है या boyfriend है या if the person is in live-in वो नहीं समझ पा रहा है, तो they must go to a
Professional.
psychologist, a specialist, say like a marriage counselor or a counselor who get into a relationship counselor basically, who can tell
Okay.
you about all these things.
Right.
So that is very important. Then the friends I've already talked about, that everybody together has to work on the things. And the female has to be moved out of the house.
Right. So now from, I'm just going to pick this line up that moving out of the house, some of them can be, working professionals. And
Yes,
so
certainly.
how can returning to work or engaging in new activities, positively influence their mental health?
Right. So getting back to work,
Yeah.
will shift their mindset from one place to another.
Mhm.
They will have
Right.
lots more to think about, lots
Right.
more to do. They will have lot more creative aspect rather than
Right.
just self-brooding about something which they don't have or which they missed on.
Right.
So,
Right.
so working is going to help them and grow them better with the mental. They'll feel more happy because working will give them that reward.
Okay.
Yeah, there'll be a satisfaction. Oh, I've achieved something. getting back to work, getting those appraisals, getting those praises from the colleagues, from the seniors, the subordinates. So that would again give a praise, a reward, and that reward which gets into the brain again, helps in generating those happy hormones in the brain,
Right.
and which
Right.
helps in early recovery.
Yes.
So shift in environment and the reward system.
Yes.
Reward system, not that she's being rewarded with a trophy every time, but her
Yes.
own work satisfaction will give a mental reward too.
Yes.
That
You
I've
know that
achieved something.
that's constant self-consciousness about going through something, and
Yeah.
actually she'll be distracted,
Yes.
and then
Yes.
probably she can channelize that energy into something more productive.
And then moving out will make her also feel that no, I'm not different. It is not that,
Yes.
sitting at home will make her feel so many things. People are going to laugh at me. How are they going to look at me? How will I like that body shaming? But when she'll move out and when she'll realize that nobody is doing like that with me,
Yes.
I'm accepted as normally as I was earlier, or maybe in a much better way. So she'll have that self-confidence about her own body image.
Yes. Absolutely. Right. और अब थोड़ा सा जेनजी लैंग्वेज में आते हैं क्योंकि उनको थोड़ा ऑनलाइन एप्लीकेशंस और प्लेटफॉर्म्स पे थोड़ा ज्यादा भरोसा होता है सो जस्ट टू एड्रेस दैट पर्टिकुलर सेक्शन ऑफ द सोसाइटी क्योंकि बच्चे आजकल उसी स्टेज में हैं who can help their mothers and their aunts and maybe their cousins. So do online and digital mental health platforms play any role in providing accessible psychological support?
Certainly. But what happens, पता है क्या होता है कि आजकल जो Gen Z आता है, they're already well, I would say, literate, educated about the subject and topic. They would directly come and tell me, ma'am, CBT कर दो.
हाँ, कर दो. ठीक है.
वो आके उनको पता है, मतलब वो स्टडी करके आते हैं कि मुझे कौन सा थेरेपी चाहिए. राइट मे बी उनको एग्जैक्टली नहीं मालूम होगा कि उनके लिए कौन सा थेरेपी सही होगा, बट वो थेरेपी के बारे में स्टडी करके आते हैं. तो Gen Z, because they do a lot of Google search,
yes,
too much research about the topic and all the things, anybody would come, they come and say कि इसको तो narcissism है. These are common terms which has been, it's a late language now for the Gen Z.
Yes.
NPD.
Yes.
Or this, something like that. So they come and they tell me with all these things, ठप्पा लगा के कि इसको तो ये डायग्नोसिस ठप्पा लगा के आते हैं कि ये तो है, पक्का है. They should look for the support groups. उनको ऐसे सर्च करने चाहिए जहाँ पे they get an idea about the treatment, they get an idea to go for the places for better treatment. Mental health support के लिए वो कहाँ जा सकते हैं, क्या क्या कर सकते हैं, फिर वो अपने फैमिली एज अ फैमिली मेंबर वो अपने जो भी सफर कर रहा है फैमिली में उसको वो कैसे बेस्ट हेल्प कर सकते हैं. दैट शुड बी द बेस्ट थिंग. देन दे कैन ऑल्सो इंटरैक्ट विद द पर्सन हु हैज गॉन थ्रू दिस.
जी जी
है ना. बहुत सारे सर्वाइवर्स अपनी स्टोरीज डालते हैं.
जी.
तो जब उनकी स्टोरीज जेन ज़ी पढ़ता है या आपके फैमिली में अगर कोई सफर कर रहा है उसको आप पढ़ाते हैं तो उनको एक हिम्मत मिलती है. They feel that yes, even we can do it. This has been done. So if you read the stories of the survivors or if you see the videos of the survivors, you realize that things can be done. Nothing is impossible. So I would want all of them to go through this. And of course, seeing the professionals for the right diagnosis, for the right treatment, it is very important to go and consult them. Self-treatment, self-medication is never ever advised.
Right. I agree because बहुत सारे digital platforms की credibility questionable हो सकती है. We don't know which is the right platform to refer to. So I mean you're absolutely right that self-medication and self prescription और अपने आप ही एक किसी भी random app पे depend करना can be a risky process.
और सबसे बड़ी बात तो ये है ना कि he doesn't know you personally or any of these apps know you personally. They would give you all the general information that what can happen, what they'll tell you about that what minimum and the maximum can happen. But if you're reading our brain has the power of attracting all the negative. So if you're
Yes.
reading, you'll go through the worst points, right? And if you go through the
Right.
worst point, that will create and increase more of your anxiety. That ये अगर मेरे साथ हो गया तो,
जी,
but
बिल्कुल.
the professional know you would know you personally. आपके
Yes.
टेस्ट होंगे proper, and उसके हिसाब से diagnosis होगा, उसके हिसाब से chemotherapy होगी, treatments होंगे,
जी.
which will be better.
Yes, which will be better. Yeah. So I'm just going to summarize this wonderful session, ma'am. That what role does health literacy play in empowering these? You just mentioned the heroes, our heroes, the breast cancer survivors, to make informed decisions about their psychological well-being and their overall recovery.
So health literacy is actually very, very important for the breast
Okay.
cancer. And we have this October month, the pink month. It's also
Yes.
called the pink day, right? Where it's all about the breast cancer awareness.
Right.
And we have often seen many of our athletes also playing game for the breast cancer awareness. If we talk about the boxers, if we talk about the cricketers wearing pink t-shirts and playing the matches, the boxers wearing
Right.
pink t-shirts and playing the matches, may it be males or females, it's all
Right.
about the breast cancer awareness.
Right.
Day. So the awareness is very important because the awareness literacy brings you out of the myths.
Right.
ऐसा हो जाएगा, ऐसा हो जाएगा.
Mm-hmm.
It makes you aware that things are possible for the treatment. Thinking about cancer, तो पुरानी धारणाएं चलती आती है. पहले था कि कैंसर हो गया मतलब it is not treatable.
Treatable, yes.
It is if once you have been diagnosed with cancer, that means you're going to die. It's the ultimate thing, but it is not that now.
Yes.
Yeah, you get to know how to diagnose. You get to know how to find out. Yourself also you can find out about the things. Then you can consult the
Yes.
doctor. Then
Yes.
how the treatment can go. How can you go for the treatment? You can search for that. Which doctor to consult? There also you
Right.
can know from the health literacy about it, right?
Right.
So health literacy is certainly very important. Important, which tells you about all the aspects from
Ji.
the time of diagnosing, from the time of knowing about then the treatment, then the post-treatment part, and then the settled part, the
Yes.
fear of reoccurrence and all that, and of course
Yes.
the mental health part.
Right. Right. तो बहुत सिंपल सा solution है कि अगर कुछ एक प्रॉब्लम डायग्नोज हो भी गई है तो the treatment is very much possible और उसके बाद you have an entire fraternity to support you and all of us are with you, right, ma'am?
Yes, we are all with you.
So on that wonderful note, ma'am, I deeply appreciate your presence with us today, and I'm hoping that this session will prove to be incredibly beneficial for all the ones who are fighting breast cancer, and I'm sure they're all going to be victorious in their journeys. So thank you so much for joining us today. It's really been a pleasure.
Thank you so much.
Thank you so much, ma'am. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again.